Also, I want to let everyone know there will be a reception immediately after this, following in the DRC2 auditorium, where we'll have a chance to mingle with the speakers and talk to the company people a bit. For those of you who don't know, Michael Dixon with UNIMED. UNIMED is the technology commercialization and development entity here at UNMC. So our goal is to see technologies that are created in the lab developed into products that help improve healthcare. We really recognize that the technology development is a long, expensive process, and so that's why we created the demo day, to try to give you, to give everyone a glimpse at some of the hard work and development that's going into creating the technologies of tomorrow. So it's a very tedious process, it's a very expensive process, and I think we've got some companies that are just doing an amazing job developing products. And these are really the products of the next generation. So we're looking forward to seeing them develop these technologies further. So next, we are fortunate to have John Glock, president and founder of Labpoint, here with us today. So John is actually a veteran of UNMC startups. He, 15 years ago, was with a company called HKS, or now Otter Chronic Care Solutions. He's then came back, worked for our public health lab here for a while, and then spun out Labpoint in 2007. So John's a great example. He saw a need in the private sector to service it, where he could do some data integration and provide some services. He's built a great company and is now working to build an even better product that I'll let him tell you more about now.
Thank you, Michael. Hi, everybody. Like Michael said, my name is John Glock. I'm the president and founder of Labpoint, and we grew out of the Nebraska Public Health Lab, which a lot of you know is housed here at the Med Center. The Department of Pathology operates it. Unique in the country. I think the closest other state that comes to that is maybe Iowa, but they're not very close to actually having the public health lab operated by a university in the arrangement that we have. So a lot of good things have come of that. Public health labs are typically your nondescript, beige, sometimes gray building in the state capital of the state, and they're just a line item expense. Whereas here in Nebraska, the public health lab has had access to commercial lab information systems, for example. You know, $1 million equipment that most public health labs simply don't have. Only in the recent couple of years have we seen other public health labs, and I hope to some extent they're following Nebraska's lead. Other state public health labs are adopting some of the commercial software systems and techniques and business processes. So we were formed in 2007. We have two primary customer bases. The public health, which I mentioned, and this would be serving mainly public health labs and their constituents. So local, county, state health departments, all the way to federal. We work closely with the Association of Public Health Labs and their partner, the Centers for Disease Control. The other side of our house is what I refer to as the commercial business. An example of that is regional pathology services here at the Med Center, the outreach and reference lab that serves the region. We have three lines of businesses. In the industry, they're called integration. In an IT sense, that is connecting two systems. For us, it means typically connecting a lab system, a lab information system, with customers of that lab. So other hospitals, other laboratories, doctors' offices, et cetera. And even though there are standards, the common one you may have heard is HL7. The old saying is, if you've seen one, you've seen one. It's not very standard. And so that's where we come in. We are software developers by trade. We use what's called an integration engine to do our work. 15 years ago when we started, the only integration engines cost $1 million and weren't attainable for this type of use. They were usually just in enterprises. We wrote our own, and it was a hack. And it served its purpose for a long time, but now there are open source tools and there are commercial products that have come down in price and allow us to utilize those. The other line of business with public health and our work with the Association of Public Health Labs, probably about 5 years ago, we were at the forefront of helping architect a national network of public health labs in conjunction with the CDC. We utilized a software developed by the CDC, and Nebraska was the first state, kind of the guinea pig, to participate in this network. I'm happy to say we went from 0 to 1 being Nebraska to recently we're approaching 50 public health labs that participate in this network, and the Centers for Disease Control, a couple of big national reference laboratories. And I wouldn't have put my money on being able to do it. It was our team and folks at Association Public Health Lab that helped pull it off. The third line of business is could be construed as a service. It's really a product. It's a software product that we developed way back to the early 2000s. It had its roots in the lead program and getting lead results out to the folks that need it, primarily in Lincoln. So this was kind of a result of bringing the public health lab here in the late 90s. The folks in Lincoln said, hey, wait a minute, you're not next door. I can't just come down and get my lab results. And so this was kind of the answer to that. So Elert is a number of things. It's the proverbial elephant. It's different things to different people, but first and foremost, data collection in the form of orders. And it's web-based and sits out in the cloud, allows remote clinics, public health clinics, which might reside in a hospital or your doctor's office, to collect data, collect lab orders, place lab orders into the system. And those are transmitted, so that's where the integration piece comes in, transmitted to the public health laboratory. And it's, as I kind of alluded to, it's not just transmitting in a standard format. It has to be sliced and diced, and that's what we do with our integration engine. Put in the format, translated, so maybe your code for blood is BLUD, my code is BLOD, and it has to be translated at some point. Pretty robust reporting mechanism. Reporting in its simplest form presented back to the person that ordered it as a lab result, but there's a lot of people downstream, a lot of entities downstream that want that data, not the least of which is our federal government and the CDC, and communicable diseases that have to be reported up, reported to the county, reported to the state, and then onto the CDC. They use what's called NEDS, National Electronic Disease Surveillance System, and Elert is part of feeding that system. And then our latest thing has to do with communication, and that is, I'll talk more on that. That's a disease outbreak management module that we built into Elert. So on the left is just a screenshot of Elert. It's the result reporting query. You can do it by zip code, by county, by clinic. It depends on your user access, which is access control is kind of boring, but it's important to operate in this system. Only the people that can see the data for their clinic, their program area, can have access to it. We were a recipient of the Nebraska Department of Economic Development R&D Phase 1 grant earlier in the year, and I encourage you to look into that. It was presented to me by Michael, and turned out to be everything the website said it was going to be. It's a matching grant. We have to utilize either university technology, university personnel, and we do both. So then I'll get a little more into Elert. It is cloud-based. The newest version is cloud-based. And we are out on Amazon Cloud, which is the predominant cloud platform today. A little more on the disease outbreak management. This had its roots in the West Nile outbreak I thought for sure it had to be just a couple of years ago. When I looked into it, it was 10 years ago. West Nile hit us hard, the Nebraska West particularly hard, and I can say we didn't see it coming, what the bottleneck and the breakdown with the lab testing was. It was the paper requisition orders that came into the lab. Just got inundated. And if I'd had the foresight, I would have taken a picture of these stacks of orders sitting on people's desks. The administrative assistants, temporaries, were brought in to do the data entry. And The reality and the thing we didn't see coming was that lab information systems weren't designed for this type of surge. The way outbreak events occur, usually at the state level, state personnel will declare an emergency outbreak, usually by health district, by zip code, and they're essentially saying, you hundreds of health personnel that have no association with public health can now order lab tests for free. And so it would be your child's pediatrician, your family practice doctor is now for the first time associated with public health. The part in the breakdown was that lab information systems aren't designed to do these ad hoc accounts for these health personnel that otherwise had no association. So the idea was conceived to use Elert to manage these folks and get them into the system to allow them to order from a lab information system. So the lab information system could stay exactly as it is now. Elert does the hard work of inviting them into the system, tracking them, maintaining their account, and then communicating with the lab information system by one single generic account. And that may be a patentable idea that I was going to talk to Michael later. It may be my first patentable idea. So the real gas in the tank was when Nebraska Emergency Management Agency received a Homeland Security grant a couple of years ago and allowed us, it funded the development of this in Elert. So if you think of we're throwing a great big party and we need to send invites, that's what a disease outbreak is. How do you communicate to these folks? And there are things like the Health Alert Network that allow us to communicate to folks. But we need to reach healthcare personnel that, again, otherwise have no association with public health. And the first thought was email. Nope, that's not always the case out in rural Nebraska. One health clinic might have one email with lots of personnel, so it wasn't a secure, it wasn't a pervasive way to reach people. And some of you already know the answer. The answer in today's day and age is fax. It's determined to be secure. Every doctor, most doctors have what's known as a secure fax number, and the database of those fax numbers is available to us. So we compile a mailing list, in this case a fax list. It's a lot like Microsoft Mail Merge, if any of you use that. The system, screenshot of the editing system, you compile your letter, you use variables that get dropped in by the system. The fax gets broadcast out, hundreds and hundreds. It's smart enough to stage it so it doesn't overload itself. And then it monitors and tracks who received their fax and then who actually followed through with the instructions on accessing their account on the Elert system. And essentially what it's saying is, as you may know, there's an outbreak event. You're eligible to order lab tests through Elert, and here's how you log in. So that takes care of the bottleneck. From that point on, to the lab personnel, to receiving the results, et cetera, is exactly as it is today. But the bottleneck has been overcome. So where are we going with all this? The economic development grant that I mentioned is fueling a lot of, we're executing on a strategy plan that until we had the money was just a strategy plan. Now we're able to start pursuing things like billing, which for the first time ever public health labs are facing the need to bill. In fact, some state governors are getting tired of sending millions of dollars out of their state because their public health lab can't bill Medicaid. So they're explicitly telling their public health labs, you will learn to bill. Easier said than done. The Med Center, fortunately, has been through exactly that to bring laboratory billing in-house in the last couple of years. So although I'm not the expert, we have access to folks that are, and we're pursuing that pretty heavily. Where I come in is that we need to develop the infrastructure inside Elert to accommodate that billing. Enterprise Master Patient Index is a big, long word. In our world of integration, it's the holy grail. It's where everybody wants to be. You're essentially merging two disparate patient populations. If you can imagine your name, John Smith, at the Med Center and John Smith at Methodist. You're the same person, but the computer systems don't know that. You can't necessarily match on on name, you can't necessarily match on address. An electronic master patient index allows that matching with algorithms that have been vetted over a long, long time by very smart people. And that's something that we're pursuing and we're building in to allow for the sharing of data across disparate systems. Meaningful use compliance, I'm sure a lot of you have heard of it. We feel that with relatively small enhancements to Elert, we can allow our prospective clients to become meaningful use compliant in very specific ways. It allows them to check the checkbox on their meaningful use compliance and get the money. Tracker is an internal project, and as many of you may have experienced, internal projects are those projects that never quite get off the ground. We deal in middleware. There isn't necessarily anything I can demo you with regard to middleware. It's data flowing between systems. Well, if you imagine an interface, sometimes they can have 3, 4, up to 6, 7 hops from when a message is transmitted to where it's received. And when there's trouble, there's a lot of finger pointing. And it's not my problem, it's the downstream system or the upstream system. That's where the failure is. Tracker is air traffic control. It's our eyes and ears into our system to allow us to monitor what's going on with interfaces. If it comes to fruition, it's going to be invaluable for us and for our people that we serve. Managing a couple of interfaces, not so hard. Managing hundreds of interfaces is hard and difficult, and the person that is responsible for it doesn't get a lot of sleep because the phone rings at 3 in the morning when an emergency department isn't getting their lab tests. So Elert beyond public health. If you think of public health, there's 70 some public health laboratories in the United States, 50 states, but some of the larger metropolitan areas and counties have their own public health labs. So it's a limited market. From a business perspective, it's probably not what you're going to make your $1 billion off of. But we feel that there's a convergence with public health and the commercial world that typically wasn't there. And we think that we're poised with Elert and Labpoint to take advantage of that. And that's where our future is beyond public health in the commercial world. So thank you. If anybody has any questions, I'm happy to take them. And even afterwards, feel free to reach out to me. For better or worse, I'm what they call a serial entrepreneur. My wife would call it a sickness. But I'm happy. I'm passionate about it, and I'm happy to talk to anybody on what you might be pursuing and tell you a little more about how I got where I'm at. Thank you.